Well, good afternoon, everyone, and welcome. We're going to be talking about an exciting subject for Lewis and Clark County. We're not the first, but we don't want to be the last either. This is about the An Angel Initiative launch for Lewis and Clark County from the governor's office, and I was just telling the governor earlier, I've been doing this business for 36 years, and I've never had somebody walk in and say, I'm a meth addict, I need help, I want treatment. There's always that fear of, okay, we can help you, we'll just get you right up to the jail and we'll put you in there and see how we do. We do have programs in the jail, but maybe this goes into what we've been trying to do. Kelly McBride is here with our jail diversion. I think it fits well of getting someone right into treatment. To talk very authoritatively about the program, I'm going to introduce the governor of our state, Governor Greg Gianforte. We're honored to have him here today, and thank you all for coming. So,
Thank you, Sheriff.
Thank you.
Yep. Cool. You're very kind. So thank you, Sheriff Dutton, and thank you for your leadership. This really is an exciting program, and back in November, we were proud to launch the Angel Initiative in Great Falls. Cascade County Sheriff's Office was the first to officially partner with the state and DPHHS and our treatment partners on this Angel Initiative. And I'm really encouraged by the progress we've seen so far. And today it's my honor to really recognize our partnership with Lewis and Clark County. The Sheriff's Office really been a leader on this in getting this Angel Initiative up and running here in Lewis and Clark. We really appreciate you stepping up. I know it hasn't happened in 36 years, but it's going to happen now because we want to get people into treatment. Our shared hope, of course, is that this initiative will save lives, and I'm confident that it will. No community has been untouched by the drug epidemic we're seeing across the state and really across the country, and addressing it becomes more urgent. In Helena, this crisis is tearing apart families and devastating our communities. Just 2 weeks ago in Lewis and Clark County, we saw nearly 10 people overdose from fentanyl-laced heroin. Thankfully, there was no loss of life in that particular case, but it underscores the magnitude of the problem and the need for us to act. The Department of Health and Human Services estimates that over 90,000 Montanans have a substance abuse disorder, yet we know of only a fraction of them that actually seek treatment. From January through September of last year, the state averaged 69 opioid overdose calls per month, and last summer, Montana saw some of the highest opioid overdose monthly call volumes in the last 3 years, and in July alone, we had 82 calls in the state. While opioids still amount for the largest percentage of drug overdoses, methamphetamine-related deaths, hospitalizations, and emergency room visits have increased over the past few years as well. In 2019, the annual methamphetamine-related death rate in Montana was nearly 30% higher than the national average. Without a question, this crisis requires urgent action from all of us. Rather than sitting by, though, we're taking action because hope is not a strategy. And that brings us to the Angel Initiative. While there's no silver bullet to end this epidemic, there are steps we can take to confront it. And the Angel Initiative is one of those actions that we can take. Under the leadership of Director Meyer at DPHHS, he's thinking outside the box to reduce the stigma associated with treatment and guide individuals on a path to recovery. The Angel Initiative allows those struggling with addiction and substance abuse to go to any participating law enforcement office and ask for help and get connected with treatment. So far, nearly 20 sheriff's offices and 10 treatment providers in 33 counties have committed to partnering with us in this program. We're proud to have Lewis and Clark joining, and we're now up and running here in Lewis and Clark County, which is terrific. We'll keep adding more as we go along, The goal is to help people struggling with addiction to get into treatment and get healthy. In addition, in January, we introduced the Heart Fund as a central part of our budget. We did that a year ago. The Heart Fund represents another way to help us heal and end addiction through recovery and treatment. That's what HEART stands for. Working with the legislature, this was the single largest new expenditure in our budget. The HEART Fund provides $25 million per year to fund a continuum of substance abuse and prevention treatment programs in communities across the state. Successful prevention and treatment programs help people who have hit rock bottom regain their health, rebuild their lives, and become vibrant, productive members of our communities. Under the previous system, unfortunately, gaps existed that reduced the effectiveness of community-based prevention and treatment programs. In some communities, there was no coordinated prevention program at all. Others, there have been gaps in meth treatment. And in others, there's been a lack of local recovery support for people leaving treatment who want to stay clean, sober, and healthy. It's critical that we close these gaps, and that's what the Heart Fund is all about. And I want to be clear, this is not bigger government. This is a community grant program to help nonprofits and NGOs do the work on the ground in a way that's right for each individual community. What makes sense in Hardin is going to be different here in Helena or in any other community in the state. When addiction recovery specialists work at the local level, we're able to connect with the struggling individuals and do what's right for that community. That's why public-private partnerships are so critical in this effort to help people climb out of addiction. Know that the state of Montana is ready to bring the resources to bear to work with our local partners in combating the drug epidemic and making our communities safer and more vibrant. And as we do, we'll continue collaborating with local leaders and ensure the voices of local community members are heard. With guidance and resources from our state to improve the response to addiction, communities will lead the effort because they know the local needs best. So just to wrap up, before I turn the podium over to Director Meyer, I want to say I'm filled with optimism at the promise of this new Angel initiative. And I want to say clearly to any Montanan that is struggling today, please know that you're not alone. Treatment is an option, and there are folks that are ready to help. The road you will trudge through recovery will be challenging, but it'll also be very rewarding. You don't have to travel that road alone, but instead with a fellowship of people that will help you. We are rooting for you, and you have our support. I also want to say to the families with relatives and friends who are struggling with addiction, you are not alone either. There are others who have come before you, and we can help you. To the teams at DPHHS and Lewis and Clark County Sheriff's Office, and all who have agreed to partner in the Angel Initiative, I know we can agree that our work is just beginning. There's still much to do to get Montanans the help they need, whether they're in the grips of addiction or connected to someone who is struggling with addiction. I look forward to working together with you and all Montanans to make our families healthier, our communities stronger, and the future brighter for all. And I would ask, please pray for our state and all those Montanans who are trapped in addiction. I appreciate you being here with today to support this program, and with that, I'd like to turn it over to Director Meyer.
Thank you, Governor. And as the Governor mentioned, the Angel Initiative is new to Montana, but I've watched firsthand how it has worked successfully in other states. In Kentucky, for example, a similar program launched with all 16 Kentucky State Police posts participating. That program continues today and has helped hundreds of individuals be connected to treatment. I appreciate Sheriff Dutton's leadership in Lewis and Clark County on this issue and for his support. And I appreciate those others in law enforcement that have also agreed across the state to step up as willing partners. As the Governor mentioned, DPHHS will continue to provide training to all sites and help answer questions as we continue to roll this out in the other counties, and 10 substance use treatment providers representing 33 counties, as was mentioned, are participating as well. For participants, we've created window stickers that will designate an Angel Initiative sites once they have received the training and are an active site. And there's a website with a map showing participating locations, including contact information and an 800 number that has been set up for law enforcement to call and connect people who are in need of treatment. Again, these issues are issues that need addressed now, and it's something that must be tackled through a team effort. We must not let our guard down. At DPHHS, we continue to strengthen our surveillance systems to quickly detect spikes in overdose deaths. We are using emergency department data and emergency medical systems to identify increases in overdoses cases in the community. Recently, 2 spikes in overdoses were reported in Lewis and Clark County and in the Flathead. Between January 17th and January 20th, EMS and Helena successfully reversed 8 opioid overdoses using naloxone. Many of the dispatches were initiated for suspected heroin overdose through one reported history of fentanyl use, with one of those being reported as a history of fentanyl use. And at least 50% of these individuals required multiple doses of naloxone. Between January 11th and January 20th, 5 fentanyl overdoses cases were treated by emergency responders in Kalispell, Montana. Now, access to naloxone saves lives, and it has saved lives in these recent overdoses. Between 2018 and 2019 and 2020 to 2021, there was a 490% increase in naloxone distribution. It's a critical tool that's being leveraged in our community to save lives. These reports are startling and further reinforce the importance of the Angel Initiative. The use of naloxone does save lives, and it's important, but it does not take the meaningful, long-lasting change needed to increase that access to treatment. That's what the Angel Initiative is about. In 2015, SAMHSA reported that 40% of people who access treatment were self-referrals. That's important because people are often more successful if it's them that makes the choice to move forward with treatment. We continue to build the Angel Initiative program in Montana, and law enforcement is uniquely positioned to address substance use and increase community engagement, and we're thankful for the partnership. We're encouraged by our progress so far, but our work is only beginning. Thank you all for coming today, and please welcome our next speaker, Todd Wilson of the Helena Indian Alliance. Todd?
Thank you, Director Meyer, everyone for their leadership, and giving me this opportunity to address this important topic of substance use crisis in Montana. It affects so many of our families and our communities across the state, from our Native American population on our reservations to the towns and cities across. It affects everyone, and we're seeing that. We face a crisis that has taken our communities by storm. And we need to think outside the box when we're addressing, when we're coming to implementing strategies to combat the situation. The Angel Initiative is a program that does just that. It offers a solution from a different perspective, thinking outside the box. And that's what we are looking forward to in implementing. It's an excellent resource that can help connect the people with treatment and services they need. At HIA, we are an accredited state substance abuse provider. And we advocate for and to responsibly serve the mental, physical, spiritual, and social well-being of the Native American population and the Helena community. We are open to everyone. All ethnicities, members of the LGBTQ plus community, we are open to all, for all. Our providers will be the ones on the back end providing getting these referrals and providing the treatment services that are needed. We will get the clients the help they need without fear of legal involvement. We will ethically be able to provide treatment for clients whom are the highest need in our community. We already have a great working relationship with law enforcement, and we will be able to continue to build on that with this program. We can help law enforcement by taking referrals while they continue to keep our communities safe. We look forward to working with Sheriff Dutton and the Sheriff's Office and do our part to ensure that people are getting connected to the treatment services they need. It is important for all of our community partners to join forces and utilizes the resources that we have and work together. At HIA, we are excited to be part of this initiative. We are committed to the well-being of our community and the patients we serve. This is a team effort, and it's going to take all of us to make a difference. Thank you.
Well, we did leave a little bit of time for me to talk for another 45 minutes, and I'm just kidding, I am. So we will take some questions, but I do want to say our procedure here will be going up to 221 Breckenridge. If you want to participate in the program and say, I want to participate in the Angel Initiative, there will be training to detention officers, and they will come down, start the forms, and we'll begin that process. So I want to thank the staff that worked really hard on getting this together, putting it together, and also believing in it as well. So if you have a question, and it's a really tough one, make sure and ask the governor. If you have anything that's really simple, I'll be happy to take those. So, Governor?
Open it up.
Yes.
Any questions? Yes.
Thank you.
Yeah, so can you explain a little bit more about who would and would not be eligible for this program? Like when law enforcement is responding to calls that involve drugs, what would make somebody enter this program or not?
I can answer that, or you can.
Adam, do you want to talk?
Yep. They've educated me, but this is the expert.
Yeah, so it is meant to be a voluntary program and volitional, of course, and so it is they have to take the action. It can't be something that, on a call, right, if they're doing a home visit and there's narcotics found, right, it's not at that point they would say, oh, I want to join the Angel Initiative. Now, certainly, I know that these fine gentlemen would do what they can to connect them, but that's not this program. This program is really a voluntary program where they come into a designated Angel Initiative site, which they can find on the website, participating locations, addresses. They have an intake procedure. There are some screening requirements. For example, they can't have an active warrant and be eligible for the program. And so those are included on the website, the stickers, those sorts of things, so that people have an idea of what they're walking into. And then there's the basic framework for the program. So they are able to bring narcotics for personal use and turn them in and kind of have a safe harbor. So that is one of the elements of the program. And then they will be screened and then screened by provider. So the law enforcement entity will connect them with a screening process that will determine kind of their level of care need, and then an appropriate referral will be made. And so they will use a hotline that we've established for the sheriffs and other participants to utilize to call that behavioral health professional to do the screening, and then we would connect them with treatment.
And so you guys launched in November statewide, well not statewide, but in about 20 participating with 20 participating sheriff's offices?
So just to clarify, we launched the pilot site in Great Falls in the Cascade County Sheriff. And then we have about 20 who have confirmed that they want to participate, but we're rolling them out as we train them. And so this is the second active site within the state. And then there's about 17 or 18 more that have committed, and we're in the process of training them.
And the message is for individuals that find themselves in addiction, this is a voluntary program. If they raise their hand and say, I need help, we're going to get them plugged into a treatment program. And as long as there aren't other extenuating circumstances, they've got a safe harbor. If they bring their personal use drugs and paraphernalia in, we'll take care of them and get them into treatment. But they have to initiate the effort.
You had a question? Yes.
Thank you. Yeah, this might be a county-specific question, I'm not sure. But we've been hearing a lot about the strain that's already been placed on Montana's mental health care system. And so I know this relies on treatment services being available. I wonder if that would ever lead to like a cap in the number of participants who could come forward, or what do you think there?
There's no cap on participation. If somebody's in need of treatment, we're going to find a way to get them access to treatment. It's something that we, of course, are working through, not just within this program, but outside of it. But we want to make sure that we're giving the access points that are as many access points into treatment as we can, and that's, this is another tool to allow for that.
Time for, yes, sir?
Is there any hesitancy on the other 26 counties' part in terms of getting involved? Why don't we have 56 counties involved in this so far?
So I think a lot of it is the workforce, right? Some people may not have the extra staff to do this. Some may want to see how others address some of the issues, because there are some, one of the things that Montana is facing for the first time that I've seen with the Angel Initiative is that in most places it's been done by like one state police agency with their field offices, or it's been done in like a locality. And so each county has their own unique issues that we need to work through in coordination with county attorneys, sometimes coordinating with the local city police or individual units. And so it may be interaction with tribal police as well. And so we're working through those individual issues. And so, we're going to crawl before we walk and walk before we run, and make sure we resolve those issues and work with them so that each site that we launch is set up for success.
I can address that as sheriff. At Montana Sheriffs and Peace Officers Association, we've had those exact discussions. This is a paradigm shift. We've done things one way, we have investigated them, and we'll still have to investigate some things. But this is different. This is not taking an active role in that person. I mean, we still want to stop the inflow of drugs. We still want to work with that. We have to. But when you say we're going to stop doing what you've done your whole career, there are people that are going to go, hey, let's just slow down. Let's see how this works. Some of them don't have the opportunities like we have for treatment providers. There's a lot of other details to work out. There is interest within the colleagues, but how the details work out are moving just a little slower. We're going to do business just a little different, and they want to see how that works. Does that answer?
Yeah, Sheriff, real quick follow-up. Is there any updates on the investigation on the recent overdoses here in Lewis and Clark County?
That is an extremely active investigation. I'd love to tell you what they're doing. I really would, but my key words were active investigation. And I can tell you the Drug Task Force is making some great headway. That's all I can tell you. I hate to seem so secretive, but it's a different world. Yes, sir?
You mentioned a paradigm shift. I'm just wondering, I guess, why you expect people who are breaking the law to voluntarily come in and trust the police, not to, punish them or do something else.
Good point. I mean, like I said, we have done this I've done this for 36 years. I've never had anybody come in and do this. Now we're saying, hey, you can come in, you can turn yourself in. You're not getting that property back, I can tell you that. We can't be in the distribution business. But through this initiative, and they can look it up, they can talk to the other people, they can come in and they can get help without going into the legal system. And it's been talked about, wouldn't it be neat? And the governor brought it about. So yes, there will be some trust. And yes, we do have some other community programs that they can work with as well that I mentioned when we first started. It will be a trust issue right off the bat.
It's going to take courage on the part of the individual, but we can't keep doing the same thing and expect a different outcome. So this is a new tool that's available to help people get treatment.
Yep, got time. You got time for a couple more?
I'm just curious, this will be quick.
Can you pull that down just a second? You have a soft voice and I can't hear
Oh,
you.
sorry, excuse me. Do we have any numbers out of Cascade County yet on like how many people have stopped treatment?
So at this point, it's from a HIPAA concern. I think we would not want to cite that just because under a certain amount. But there has been engagement with the Cascade County Angel program as well.
Yeah, does Lewis and Clark County have any available medical detox services for these people? Where would they go if they need to detox?
Well, right now, under this program or the...
Under this program.
Under this program, we have it. You want to address that?
Yeah. As far as the medical detox, that would be on a provider to provider with the outreach program that they have in place. But for us specifically, we'd be providing the treatment services, and any of the evaluations that need to be taking place, and then refer them whether they need a more intensive care or into, a facility that requires, a bed and housing. But for the detox, that would be up to the organizations or the entities in town that would have that availability.
And correct me if I'm wrong. I mean, based on your assessment, it might be determined that someone needs an inpatient program
Yeah.
versus outpatient. So that's what they mean about the trying to determine what program. And Director, how many treatment programs have said they're going to participate in this program?
There's 10. Some of them have multiple locations. So I think there's pretty much statewide coverage as it relates to providers.
And does that include a medical detox center in Lewis and Clark County?
I do not know that.
One of the things that you would have to assess is, are they hemodynamically stable? You know, is their blood pressure okay? Is their pulse rate okay? Are they doing okay physically? If someone sees that, if they're, you know, you don't know, are they having I'm trying to think of an educated way to say, are they tripping on meth? Are they going to have a breakdown when they're talking to a provider? The providers are trained to look at that, and the emergent would be to get them to emergency care at St. Pete's or some place like that, and get them stable and then bring them back. But that's where we just as soon not be involved, because they're not involved in the criminal justice system now. They're involved in the private, and that's the beauty part of this, is that they can talk, they can, information that they're giving is confidential. Does that answer your question?
Not quite, but
Okay.
that's okay. I can follow up later.
Okay.
Yeah.
We could probably get a list of providers, right?
Okay.
We have it, we can get it to you.
That's great.
We'll follow up with DPHHS on that.
Jonathan?
Governor or Director Meyer, I was curious what the expected timeline is for when you might fund or the other counties participating in the initiative.
As quickly as possible.
But no idea
Yeah,
yet of
so-
when the training might happen.
It's kind of as they're ready, and as they're available. And we initially were looking at doing an in-person training, getting them all, and we found the logistics of that for planning were very difficult. So we've started doing, like we had 2 the other day, including Sheriff Dutton that we trained, and so we may do it in 2s or 5s, or it's really about when they're ready, and then what our capacity is to train and the logistics part of it as well.
Yes.
Sure.
Stuart?
Yes. Do your deputies carry Narcan? I know HPD is starting to carry Narcan, and you're seeing law enforcement around the state do that. Is that something they've been trained in? I know there's a tomorrow they've got another training session for the public, but is that something that Lewis and Clark County?
Yes, they have. They have it, and they've been trained.
Great. Thank you for coming out today.
Thank you, appreciate it.